young, I want to feel pretty, I want to feel confident, I want to be able to look at myself in the mirror and love what I see. What's up, y'all? It's your girl Stephanie back again with another video. First of all, I want to say how much I appreciate the support that I've gotten for my first video. I did not think I was gonna get that many views or comments, likes, shares, or subscribes from a video, especially that video. I didn't think I was gonna get anything from that video because it was just an intro. It wasn't really like anything that was too out of the ordinary or too special or too entertaining. It was just a get to know me video. So this video's topic is about something dear to my heart. It's something that I was very hesitant about speaking about because normally when I see this topic being talked about on social media, or if I hear people talking about it, it's usually always negative things that come from behind it, because I don't really know why. I think people just always give that impression of, you know, like, I would never do something like that. I don't have the need to do something like that. And you know what? I'm just now about to be 21 in April, and I can honestly say that I've lived like most of my life living for other people. I've spent too many years, months, so much time doing things because I was worried about what other people were gonna say, or I didn't do things because I was scared of what people were gonna say. And I'm just not getting to a point where I don't really care anymore, because I can't be living for anybody but me. This is my life. At the end of the day, I have to wake up every day and I have to make sure that I'm happy with me. There's no way of me to do that if I'm living for this person and that person and that person. Even if it's the people closest to me and the people that I love most in this world, I can't be living for them. So that's something that I battled with a lot within the past few years. It's kind of like I would want to do something, but then I had to like battle myself, and like I had to fight with myself about, you know, well, what is this person gonna say? Well, how are they gonna think? And how are they gonna feel? And I'm also a very big empathetic person. Empathetic people, you're always worried about how the next person is gonna feel. You're always putting yourself in someone's shoes. So you might be thinking to yourself, like, you know, I really want to do this, but how is this person gonna feel? How are they gonna take it? So then it's like you start to beat yourself up because you're worried about how it's gonna affect others. And even though I feel like that's a very generous way of thinking, but at the end of the day, you're only self-sabotaging yourself, because you might be making other people happy, but who's making you happy? Or are you making yourself happy? You have to be your main source of happiness, or else I don't think you're not gonna get it. And if you do get it, it's only gonna be short term, because people aren't dependable. Everybody has their own problems. Everybody has their own demons. Everybody has their own flaws that they have to deal with. So a person could be making you happy today, and they could be making you cry tomorrow. So you can't be living off of other people's happiness, or you can't make your happiness depend on the next person. So sorry, I wasn't expecting to say all that. Basically, cutting straight to the chase, this video is about plastic surgery. For those of you that don't know, I got plastic surgery last month in December 22nd. Now, usually when you say, or when anybody says plastic surgery, the first thing people think of is, oh, she got her butt done, or she got a BBL. I didn't get a BBL. Let me just put that out there now. I did not get a BBL. I already had a few people ask me if I did. I didn't. I didn't get anything done to my butt. I don't have the biggest butt, I know that, but I don't really care to have a bigger butt. I just really wanted to have a pretty shape. I've always been pretty thick, always been curvy, always been a curvy girl. But over like the past 2 years, I did gain a lot of weight in my midsection, and I feel like it was just so hard for me to lose it. I made so many changes, tried so many things, and I just couldn't shed no weight. And if I did shed some weight, it wasn't in the areas I wanted to shed it at. So I've been struggling. I've been going through it. So I just was trying to figure out what it was that I wanted to do. I didn't really want to get plastic surgery because I was just thinking to myself, like, what's the point if eventually I'm gonna have kids and that's just gonna mess everything back up again. But at the same time, I was like, you know what, I'm young, I want to feel pretty, I want to feel confident, I want to be able to look at myself in the mirror and love what I see. Because I want to say for like the past 2 years, ever since I gained all this weight, every time I looked in the mirror, I did not like what I see or what I saw. It honestly could have been like something like a t-shirt. I could have been wearing this t-shirt, and I just hated the way I looked. Even though you're probably thinking to yourself, like, it's just a regular t-shirt, it's not nothing tight, it's not nothing revealing, you're not showing anything crazy. But I still hated the way that I looked, especially because I had back fat. I've never had back fat in my whole life. So that to me was really alarming. That was probably the main thing that I hated the most, was the fact that I would put on a shirt, I would look back, and I hated that so much. So like I said, I completely changed my diet, completely changed my lifestyle. I eat nothing but healthy, clean now. Obviously, I do still give in to cravings, you know. It is okay to give yourself the things that you want. You can't deprive yourself of things that you want, because if you do, eventually you're gonna break in and you're gonna go on a binge, and then you're gonna feel even worse about yourself. So it is okay to have unhealthy things in moderation, small portions, because at the end of the day, I'm not doing this for 6 months or 3 months or 90 days. This is a completely change to my lifestyle. So obviously I have to implement a way to have unhealthy things in a healthy way, if that makes sense. So I don't want to make it seem like I'm just the healthiest person in the world. I'm not. But I did make a lot of changes and a lot of sacrifices to my diet and to the things that I like to eat, because I wanted to see a change. And I did, but not fully how I wanted to see it. And that's why I ended up getting lipo. This was something that I did think about for, I want to say since early into the summer last year, summer 2021. That's when I started thinking about it. I had went to a plastic surgery center in Lansing for a consultation. I looked it up online. I went to one that had a lot of nice reviews. So I went in for a consultation, met with the doctor that worked there, and I don't want to insert any names or anything just because I don't want to make it seem like I'm bashing them, because I don't think they're a bad place. It was just kind of like a gut feeling that was telling me don't go there, you know. So sorry, my nose is itchy. So I went to see a plastic surgeon in Lansing, but I didn't go through with it because it was just a few things that I didn't like. I didn't really like the feeling he gave me. He kind of gave me the creeps. I don't know. I think he was just a really old doctor. He had a really low voice. He just didn't give me a welcoming feeling. And I feel like if you're going to be meeting potential patients that you're going to be putting to sleep, putting on a table naked, and cutting into them, I feel like you should be giving them a better welcoming than what I got. You know, he just kind of came in the room. He was just like, hey. You know, I don't know. It just wasn't, I just don't think it was the right fit for me. You know, I'm very intuitive, very in touch with my feelings. I follow my gut a lot, and my gut was just telling me like, this isn't the place for you. So like I said, I went in for a consultation. I felt like it was rushed. I came in with a lot of questions, and I left with probably only less than half of them answered, because I felt like he just wasn't really like interested in the questions that I wanted to ask him. And then he was talking about doing a tummy tuck, and I was telling him like, I haven't had kids. He was saying I was gonna need it because of loose skin, but I'm like, I'm still young. I don't think you know, obviously he's a doctor, he knows way more than me, but I was just like, I'm not getting no tummy tuck, period. I don't care what nobody says, I'm not getting a tummy tuck. And you can't force me to get a tummy tuck, because I'm the one that's paying you, so you're gonna do what what it is that I want. You know, you're not gonna talk me into getting a tummy tuck, because I knew for a fact that I didn't want that. And then he was also talking about doing a fat transfer. He was like, yeah, we can inject the fat into your butt. So basically he was talking about doing a BBL, and I was telling him, I was all like, okay, I know I don't have the biggest butt, but that's not what I'm here for. I literally want one thing, and that's liposuction. So those things kind of just rubbed me the wrong way. So after my appointment, I never really went back to it. And I was just like, you know what, if it's really meant for me to get liposuction, God is gonna put me in the right hands at the right place. So I just left it alone, never went anywhere else, never looked. I really just didn't look anywhere. I kind of just gave it up, but I didn't really feel discouraged or anything, just because I was just like, you know what, it is what it is. I was scared too, because I didn't really know if I really wanted to do something like that. The whole going to sleep portion really freaked me out, because I don't know why, I was just scared of like not waking up. I've never had surgery before, so yeah. So a few months after that, I was talking to my mom. We got back on the topic of liposuction, and she suggested I went to this place inside of the Amway that's called Plastic Surgery Associates. And she knew about that place because she has a friend that went there to get work done like years ago. And I didn't even know that there was a plastic surgery place inside of the Amway. I'm pretty sure y'all didn't either, or maybe y'all did, but I really didn't. I just thought the Amway was just a hotel with restaurants. For those of you that don't know what the Amway is, it's probably like the nicest hotel inside of Grand Rapids. It's really huge. I don't know how many floors it has, but it's humongous. I looked into that place, made an appointment, went in for a consultation. The minute I walked in to the minute that I walked out, I had nothing but a great experience with the whole staff, from the receptionist to the surgeon's nurse to the patient coordinator to the lady that was walking down the hallway. It was just, everybody was just super nice and super welcoming, so I really enjoyed that. The surgeon that I chose to go to, his name is Dr. Douglas Vanderwood, and this surgery place does have 12. I'm so sorry, I was reading I was reading my timer. I've been on camera for 12 minutes and I just messed up. That place has 4 surgeons, 2 females and 2 males. So before I made an appointment, I sat down with my notebook and pen and my computer, and I looked up each person, looked up their background, their experience, their education, their certifications, you know, just, and their reviews, things about them, just to kind of pinpoint who I wanted to go to. They were all very much qualified, but you know, something was just drawing me to Dr. Vanderwood. It was just, I don't really know, it was just something about him that I really liked. So I went to see him. He was the one that I decided to go with. He was super nice, definitely dedicated, or I felt like he was dedicating a lot of his time to me. When I went in for my appointment, I did not feel rushed at all. I was able to sit down and ask him all the bajillion questions that I had for him. I asked him if he had any deaths. I asked him, you know, complications that are common with this procedure. You know, I just wanted to know a lot. I have GAD, which is generalized anxiety disorder, so doing things like this was like really having me shaking. And my mom was like, you know, if you really got to think about it that much, just don't even do it. But it's like, I feel like, period, anybody that goes to get something like this done, you want to make sure you're asking a lot of questions, because you want to make sure you're in the right hands, and you want to make sure you're going to the person that's the best fit for you. So I was like, there's nothing wrong with asking questions, you know, and he reassured me of that. You know, he was like, you know, you're asking all the correct things. So I was like, you know, period. So I asked him about the recovery process. He was very honest and open about every single thing, so I really did appreciate that. After I met with him, I met with the patient coordinator. She's the one that tells you how much your surgery will cost. So yeah, so once I made everything official, I was just focused on getting myself ready mentally and physically for lipo, and also preparing, buying all the supplies that I needed, because this surgery ain't no joke. When you come out of surgery, you're literally going to be draining blood out of your incisions. I had a total of 8 incisions. I had two in my stomach, my lower stomach, 2 in the sides, 2 in my lower back, and then 2 up next to my, like by my bra strap. So basically what they do is they cut like little tiny incisions. They're like probably like 1 inch long on each side of whatever area they're doing, and then they inject you with like a whole bunch of fluid, and then they have like these super skinny long tubes that they put into the incisions, and that's what they use to like suck out all the fat. So I've seen videos on YouTube of them doing it. Ooh, and it looks so cringy. It looks so cringy. I don't know how some people get liposuction awake. I don't know how they do that, because I would not want to see that. So yeah, that's basically what liposuction is. All they do is surgically remove fat from whatever area you want it from. Like I said, I had it in my stomach, sides, and back, and so far I have nothing but great things to say about my recovery. It does take about 6 months to recover from liposuction because you have a lot of swelling. So when they remove all that fat, your body automatically like basically replaces that fat with swelling, and then it takes a long time for that swelling to heal. Obviously, some people's body retains fluid like longer than others, so it really just kind of depends on the person. But as long as you're drinking a lot of water, drinking a lot of like pineapple juice, staying hydrated. Arnica tea is also works really well with swelling. You know, moving around, exercising. Well, you can't exercise right away, but I just mean like moving around, walking, making sure you're doing things like that. Your swelling should go down, you know, at a good rate. You know, getting massages as well. Massages are, I remember my first massage was very painful. I've been getting massages, I've just been doing them here at home. My boyfriend usually does them every night when I get out the shower. And I also bought a massage roller, so I'll just do it myself sometimes. And I haven't really seen any problems with that. The massages are really for the swelling, and also so that you don't develop fibrosis or seromas. So I haven't had any problems. I haven't had any infections, any blood clots, thank God. That was something I was super scared of. So I was just making sure that I was moving around a lot, probably too much, because there was like 2 times that I did feel like I was gonna pass out, probably because I was moving too fast. But now I'm like fully normal. Not normal, because I'm only 1 month post-op. I still have 5 more months of healing to go, but I just mean normal as in I can finally do everything for myself. The first week out of surgery, I could not do a lot of things. Like I couldn't bend over to pull up, like let's say pull up like my pants, couldn't do that. I couldn't wipe myself in the bathroom. You know, that's TMI, but I think we're all girls here. And if you're a dude and you're watching this, you know, unless you want to get lipo, I don't really know why you're watching this, but I definitely appreciate the view. So, you know, sorry if this is TMI, but this is for the ladies. So I had a lot of trouble like wiping myself because it was hard for me to like bend. Every time I would try to like bend my back or twist my body, like my back just felt really sore and stiff. And it's like I didn't have full range of motion. So that's what that was. But that did go away after like the first week. Then I was able to start cleaning myself on my own, but I did have a lot of help. So if you're gonna get something like this done, you do need help. I don't think this is something that people can do alone, because like I said, you can't bend over, you use your stomach muscles for a lot of stuff, and I didn't realize how badly you use your core until I had this done. So just like getting out the bed was so hard for me to do. It was so painful. It was really painful. It was hard for me to sleep the first couple of nights, just because every time that I would try to like turn my body, I just felt like I couldn't do it, because I just felt so weak, because my stomach would hurt, you know. But I honestly think I had a good recovery. I didn't have necessarily any pain. It wasn't really pain. It was just more like weakness and soreness and stiffness. That's basically what it was. I never had to take any pain meds besides Tylenol. They did give me Norco-10s, but I didn't take any of them because I never got to the point where I felt like I needed them. I did tell myself if I'm really in a lot of pain and I need them, I will take them. But other than that, I didn't want to take them just because those drugs can be very addictive, and I was kind of, you know, scared of them. You're not gonna get addicted if you use them for like a day or two, but I just didn't want to use them unless I really needed to, and I never got to that point where I really needed them. I was fine with just taking Tylenol. The first day out of surgery, I thought was gonna be the worst, but I actually didn't feel that bad. Like I was up and moving around, and my mom just kept, like, she's so sweet, and I really appreciate her help, but she was like hovering, and it was just kind of stressful. I was like, Mom, like every time I would get up to just do the smallest thing, she would just come in the room like, what do you need? Are you okay? And And I'm just like, Mom, like, I'm fine. And then she'll be like, sit down, you need to sit down. And I was like, because I felt, I'm not gonna say I felt the greatest when I got out of surgery, but I didn't feel like I needed to be bed bound. Like, I was good enough to walk around and, you know, grab my own juice out the fridge or my own water out the fridge, and she was just acting like I was crippled. So yeah, she's so cute, and I appreciate her help, and I do appreciate how supportive my parents were and my boyfriend during this process. I know some people don't have good support system. Like I said, this did not come lightly for me to just get in front of a camera and talk about what I had done, but it's out there now. If you guys have any questions at all, if you guys want to see anything specifically about my journey, I do plan on turning this into like a series about lipo. So this is just going to be like the intro into lipo, where I was just telling you guys about who I went to, why I chose them, how I chose them, you know, just how that was. But I will do other videos about like all the supplies that I bought for surgery. I will give you guys like an in-depth video on how exactly the whole surgery went, like the day of surgery. I will do a video on posting my results. I might insert clips into this video of how I look so far, but the pictures that I do have are kind of like me in like a bra and underwear, so I will try to like cover it up a little bit so that it's appropriate for YouTube. But if I'm not able to hide everything I need to hide, then I just won't show anything until the next video where I can actually take pictures of myself. Like I said, right now I can't take pictures because I'm just super swollen. So thank you guys so much for tuning in to this video. I appreciate every single one of you guys. Don't forget to like, comment, and subscribe, and follow me on social media. I will see you guys later. Till next time, love y'all.